This is a recruitment session and information session for the California HEAL program, specifically for the Social Medicine Fellowship, part of the California HEAL group. Um, this session should last no more than about an hour. You'll hear from myself, some of our hub leads, a alum, former fellow, as well as our co-founder Shri, and we will end the session with a quick Q&A. This session is being recorded, so if you have to jump off at any point, that's totally fine. We will be distributing the recording after the session. All right, and just to do a quick intro, how about we have the panelists all introduce themselves? I'll kick us off. My name's Avery Lico. I use she, her pronouns, and I am the California HEAL program manager. So all things California HEAL, I am your go-to. And how about I pass it off to Milo to introduce himself?
Hi there, I'm John Milo Dover. I'm a recent graduate from the HEAL program, specifically from the Inland Empire Hub. Telemedicine trained physician. Uh, Looking forward to starting my next work and everything.
And Robin, do you want to go next?
Yes. Hi, I'm Robin Linscheid Jansen. I am a facilitator for our Fresno HEAL program, and I am a UCSF Fresno faculty in family medicine. I'm a family medicine physician.
Great. And to round us out, I'll pass it to Shri.
Hello, everybody. I'm Shri Shamsundar. I am one of the co-founders and directors of Heal, and great to see all of you. And I'm internal medicine trained. I'm actually on service right now, and on long call, which I'm sure many of you can relate to. And yeah, I'm excited to have this conversation and excited about folks that might be interested in Heal.
Awesome. Thank you. Yes, Shri has been on call for many days, and so we appreciate you ending your clinic time with us here at the info session. Awesome. All right. Well, first question for the group. Where are you calling in from? Kia, if you want to launch the poll. We'd love to hear from y'all. All right, and it looks like we've heard from some of y'all. We'll give it a few more seconds. And all right, Kia, if you want to share with the group. Oh, I am not able to see the results.
We can't see it yet either.
Okay. Huh.
Okay. I will look on the back end and try to get those in the chat.
Okay, cool.
And yeah, let y'all keep going.
Cool. Okay. Let me see. Okay. Not a problem. Awesome. Thank you. Cool. Well, moving right along, as I mentioned earlier, today we'll be going over a quick overview of HEAL and why we've expanded into California. This is a recruitment session for our third class of social medicine fellows. A bit more about the program offering itself, the three hubs we work in the state of California, and then we will do a brief overview of the application process, and we will round out on a quick Q&A section. And with that, I pass it off to Shri to continue us on.
All right, thanks, Avery. So the mission of Heal is really to connect, train, and mentor health workers committed to resource-denied areas. And we're trying to build a lifelong community of leaders that are actually transforming the health systems from within. And so I think we've come to this couple sentences that might just seem like a mission statement on a slide, but it's really out of, coming out of residency, I spent a lot of time in East Africa and rural India, and Heal has had a lot of experience in Navajo Nation. And so as we know, health workers that are working in these communities really need support and mentorship, and the goal is to kind of really drive a community around shared values of committing to resource denied communities. And our vision is really envisioning a world of people like yourselves with the leadership and resilience and resource to get high to deliver high quality care in all the communities that we serve. And so, as we know, the places that need the best healthcare are the that have the highest burden of disease or the most resource denied often have the fewest and most stretched health workers. And so HEAL's goal is to kind of support those health workers that exist there and also grow the number serving these communities. And so how we work is really we partner with med centers, health organizations, FQHCs in underserved communities. The goal is to really partner with like-minded organizations that believe in healthcare as a human right, that are working towards dignified healthcare for resource-denied populations. And then we recruit, it's a cohort model where we're recruiting healthcare workers into HEAL, and it's specifically interprofessional, and the goal is and then as we recruit folks, it's a longitudinal cohort. In the California case, it's 1 year training, mentoring, and connecting. And so we found kind of the mentorship is incredibly important, the training is important, but the community is probably the most important of connecting to other health workers that are like yourselves, whether it's within and across California or across the world where HEAL has a footprint. And I think HEAL's impact traditionally over the last 10 years, we're a global organization that applies this model to underserved communities through our local programs. So we have local programs in Mexico, Malawi, Navajo and Zuni nations, and California. And so these programs are led and really run by health workers that really understand those contexts, and that's true in California as well. And then collectively, it's a global organization and a global community that has incredible offerings throughout the year, mostly virtually, but also some cross connections in person. I went on mute, but why California? I think we've worked in Navajo Nation and in the Global South for many years, and coming out of COVID, we stepped in to kind of the largest surge of the world in Navajo Nation at the time, and we were able to present to the regions of California and had a lot of press around that, and a lot of different entities around California talked about can we leverage kind of world-class academic institutions to really do more with resource-denied communities, lean into some of the most rural places in California and support health workers there as well as kind of drive talented people to work there. And so, as we know, California is not an exception in the world where health workers are needed most. Oftentimes, they're short-staffed and under-supported, and so we've always believed that we need to guard against some of the voyeurism of caring about populations elsewhere and really ground ourselves in caring for populations right in our backyard as well as around the world.
Awesome. Thank you so much for that intro and brief history of HEAL. For this next section, we'll be diving into the specifics of the program of the fellowship. So the HEAL California Fellowship has two types of fellows. We have social medicine fellows, which we're recruiting for now, and community fellows. And just to clarify on this slide here, this session is for our social medicine fellows. We recruit for our community fellows starting in roughly December-ish through January of 2027. Um, as said, our social medicine fellows are typically early career physicians, med peds, IM, FM, or peds folks. They will be employed by UCSF HEAL if selected for the program. And the early deadline to apply is mid-September, September 15th, and the final deadline is October 1st, which we'll talk more which we will talk more a bit about later. And just to touch briefly, the second type of fellow that joins this cohort is a community fellow. These are non-physicians, non-clinical staff. These are health workers of all cadres, such as community health workers, doulas, health translators, MAs, and they stay employed at their current site. And this is essentially a professional development leadership opportunity moment to join the HEAL community. All right. For the 1 year social medicine fellowship, it starts in June or July of 2027 and would go through June of 2028. It offers one-on-one mentorship with local, very experienced physicians, such as Robin, who is on the call. She is one of our Fresno co-hub leads. It also offers in addition to your 70% clinical time, what's unique to this program is we do offer 30% protected time for a social medicine, health equity oriented project. And throughout the year, there is offerings of both in-person and virtual trainings. For example, in the summertime, to kick off the fellowship, we have a week-long training called Global Health Training, where we all come together in the Santa Cruz Mountains and learn about the HEAL core pillars. Um, all right, and more into the nitty-gritty of the program benefits. Our social medicine fellows are offered up to 160K salary with comprehensive benefits. You also get to join a peer cohort of not only physicians, but also local health workers doing similar equity, justice, and justice-oriented work in the state. And you also get to join an ongoing, growing group of HEAL alum. I think now we actually have over 250 alums since the most recent graduation back in June, who all stay connected for life. All right, and here's just a brief snapshot of a year at year at a glance. The sections in blue are our week-long trainings, which would be the global health training, where our California cohort comes together with our Southwest Indigenous cohort as well, coming together in community, learning about health through both a global and local lens. And then the blocks in yellow are the weekend quarterly gatherings where we actually have our California fellows come together, typically in an Airbnb, more relaxed style space, for a weekend to come together and reconnect with the HEAL core pillars. And those take place in the three hubs we serve, which are Fresno, the Inland Empire, and Los Angeles. You also will have monthly, typically in-person sessions with just your hub that is led by your mentor or hub lead. And then we round out the year with the week-long June training, which is typically in Flagstaff, Arizona. And that's when we get to hear from our fellows and they share about the work they did over the year, things they learned, things they grew from, things they struggled with. And you all get to have a graduation ceremony to round out the year. All right, and for this next section, we will be diving into the specifics of each hub offering. As a reminder, we operate currently out of Fresno, the Inland Empire, which includes Riverside and San Bernardino. And for this third year, we also have expanded into Los Angeles. And Shri touched on this a bit as well. Our California hubs are structured with typically an FQHC as the clinical site, as well as an academic medical institution backbone, such as UC Riverside or UCSF Fresno. HEAL also operating as the backbone org. And then typically for the 30% protected social medicine site, that can be with a CBO, for example, free clinic or a public health department. All right, and with that, I pass it back to Shri to tell us about our newest hub.
All right. So we have partnered with Oma Health, which is a federally qualified health center in South Los Angeles. And so they have been working a long time, everything from kind of working in LAUSD with high school students and middle school students, as well as having like some street medicine. It's a marginalized population that is mostly Black and Latino in South Los Angeles, and so we're partnering with them for the 70% clinical time, and then we've had a number of conversations. There's a lot. I'm actually based in LA now, and so there's an incredible amount of networks and mentors of folks doing social medicine, doing street medicine, and so we're partnering with an organization that does a lot of street medicine in Los Angeles. And so some of the 30% kind of details are being worked out, but likely the project work would be street medicine focused. And then, yeah, I think there's mentors at Harbor UCLA, which is the county hospital there in near South Los Angeles, that would likely support some of the mentorship for this cohort.
All right, and I pass it to you, Robin.
Okay. Yes. Hi. So, my name's Robin. I am core faculty with UCSF Fresno in family medicine, and I also work with Fresno County Department of Public Health as their public health physician for the maternal child health department there. Um, I was actually born and raised in Fresno, and through my faith, was raised in a strong sense of social justice and activism. So when I found Heal, I was really excited to put that into practice and have vocabulary to put that into practice into my medical career. And so I've been really excited to be a part of Heal. And I see such a need in Fresno. In medical school, I was part of starting a student-run clinic for an under-resourced community in Kansas and volunteered in Paraguay, and that just ignited more of a love for serving that type of population. And just looking around at my community to see like where is that need? And so I returned back to Fresno after residency, and I've been able to advocate for patients and colleagues through being involved in the California Academy of Family Physicians. So I've been involved on a legislative level in advocating for health issues, and then also just care for my patients through clinical practice. And then when I joined public health, I was able to serve my community in a broader sense through public health. So, and then Heal fits right into that. And so you can go, I think, to the next slide. So in Fresno, Shoaib Khan is our lead program director, and I co-facilitate with him. And Fresno has um, the the areas where our clinics are both rural as well as inner city. Both areas are very under-resourced, and both serve both a migrant farm worker population, but also an unhoused population, just a medically complex population. There's a huge diversity in ethnic racial backgrounds in Fresno. Historically, we've seen a lot of immigrant populations come to Fresno. There's a large majority of those immigrants are from Mexico or Central America, but we also have a Yemen, Afghanistani population. We have a large Hmong population, and so we see a huge mix of cultures and languages, which I love about Fresno, but also creates some barriers to care, and takes thinking um, outside of the box sometimes to be able to communicate and to understand where each patient is coming from. And so our outpatient clinics are affiliated with a large community health center, and they are rooted in that academic medicine because they are run by our UCSF Fresno faculty and residents. And so we have the opportunity in family medicine to have primary care clinics, but also we have specialty services within those. So myself, my interest is in perinatal care, and I continue to do OB care, both inpatient and outpatient. And so our faculty, there's a group of us who run our prenatal care clinics, as well as I'm program director for our maternal child health fellowship. My colleague and director of the HEAL program, Shoaib Khan, he runs a lot of harm reduction clinics within those community health centers, as well as hepatitis C and HIV care. I do cross over into the substance use arena too, and chair the county's perinatal substance use task force. So there's lots of opportunities to get involved in those in lots of different specialty services. There's also opportunities to teach and precept residents. And then also opportunities through the work I do to get involved in public health. So I have had previous fellows develop PowerPoints and presentations for our public health nursing, as well as our perinatal specialists. Last year, we had a health educator from the public health department who helped develop some really great programs for dads, and those are continuing. So we've had some really great collaboration with public health. So next slide. So this is just a little bit of a breakdown. So that 70% time will be your clinical care, and that's a lot of time spent in, or can be spent in, our prenatal care hubs, outpatient, as well as this year we do have 2 fellows who are faculty inpatient on our OB and newborn service. And then depending on your expertise or interests and experience, you can spend some of that 30% time of your fellowship learning some of these specialty areas like HIV, hepatitis, gender affirming care, or addiction medicine. And as you gain expertise and feel comfortable with that, that can move into your 70% clinical time. And then you can move on to other clinical areas you may want to become more competent or proficient in. Much of your clinic, or some of your clinical time, can also be spent precepting residents and giving lectures and teaching if that's something that you're interested in too. And then my colleague Shoaib Khan is our research coordinator, so there's lots of opportunities to get involved with research projects and QI projects. Our residents are required to do these, so you can oftentimes pair with them in doing some of these. Lots of other projects in being able to develop curriculum, or other areas like narrative medicine that you might be interested in. We really can kind of sculpt that 30% time to fit those interests for each fellow. And then I guess the last point is just there's some flexibility in either spending like 1 day a week, 1.5 day a week on that 30% time project, or potentially lumping some of that together if there's a more something that requires a more extended focused time to do. I think that's my last slide.
Awesome. Thank you so much. Thank you so much, Robin, for sharing. And with that, we will jump down to the Inland Empire over to Milo.
Hi there. As previously stated, my name's Milo. I'm the recently graduated social medicine fellow from the Inland Empire Hub, specifically very closely tied with the Moreno Valley Clinic. I did my residency in family medicine with the RUHS/UC Riverside Family Medicine Residency Program. As part of my time during the fellowship, I served as junior faculty with a federally qualified health center, taking care of patients, and as well as getting a lot of that mix of both community work as well as academic work. So being able to spend a lot of time educating residents, medical students, working on better projects to better understand a lot of the different work in our area. I grew up in really impoverished areas in the high desert of California, so that's Victorville and places like that. I grew up with Medicaid, grew up relying on a lot of government programs, and knowing that there was a lot of gaps that needed to be filled, and a lot of gaps for like connecting patients to those resources. And so a lot of my work has been talking to the people specifically who are there to bridge that gap between knowledge versus actual implementation of getting access to those resources. And next slide. So for myself, the 70% of my clinical time, which is about 3.5 days a week, that was all spent at the Moreno Valley Community Health Center. So that's our federally qualified health center that is run by Riverside University Health System. There I was as junior faculty, I saw patients myself independently. I also spent some time supervising residents and supervising medical students. I had some opportunities to do procedures and stuff in clinic. And if I had put more time towards it, I could have gotten more time with procedure clinic. But I also got to work very closely with a lot of our other, specialists that we have in family medicine, like people who are very in addiction medicine. So I was able to help with continuing patient care there, as well as people in sports medicine, helping understand and helping clarify with patients like what are the specific indications that they need sports medicine and what are the specific best gaps to plug there. As additional part of my clinical time is that I also did have a couple opportunities to work in the inpatient medicine team or in the inpatient medicine team. There again, supervising residents there, helping them develop the clinical skills and everything that they need, as well as, of course, serving our community. And honestly, what is for many people their first access to clinical resources. There's a lot of people who have Medi-Cal or who don't have Medi-Cal that end up on our service that we would treat there. And that would be their first time seeing doctors in an incredibly long time. And we were their first introduction to this is healthcare. These are the different than our first time that somebody's evaluating them for the actual needs that they have that have been ignored for so long. Go to the next slide. For my social medicine time, I was very fortunate, and I think for my site is that there was a lot of flexibility for the different types of projects. So I'm sure you've heard me harp on it a lot. Community medicine and specifically community health workers are an incredibly important part of care in my mind. Essentially, that opportunity to connect people to resources that they may not know exist. There are a lot of people don't realize that there's ways to get utility assistance. There's ways to get access to food banks. There's ways to get scholarships that we can go to a community college and actually get into skills training programs. So I found a lot of times community health workers are the people who can help bridge that gap and somebody who can actually talk to a patient and help them understand what are their gaps that aren't necessarily being addressed in just a pure medicine way. Some of the programs I worked with, so I helped with our social medicine curriculum. So I participated in what's called the Healthy Eating Lifestyle Promotion Program with RUHS, the Family Medicine Residency, which is a program where residents will, on a monthly basis, go out to local high schools and will actually help those students better understand about different medical aspects in their own work and everything like that, or in their own learning and everything like that, and help those students actually develop presentations that they can give out to the community, helping give them that interest in medicine, helping giving them that interest in community needs, and giving them the tools to actually make presentations. Food as Medicine is another really important program in our clinic, which is helping connect patients to resources like even just having boxes of food for patients at the clinic, which is a lot harder of an option to have than many people would think of. I also work with Rivco One, that's Integrated Services Department in Riverside County, which is essentially making the end goal of that is that no stop or that every door is the right door. That if you go to DMV, you go to EBT, to food stamps and those kinds of services, they'll be able to connect you to all of the other resources the county has. So better understanding what are the best ways to do that. Spoiler, in my opinion, community health workers. I also worked a lot with with UC Riverside. This is both part of my clinical work as well as my social medicine work. These are things for um, in the Riverside Free Clinic, which is a biweekly free clinic. I spent a lot of time serving patients there, or more specifically, helping medical students actually serve those patients and develop their own clinical acumen and actually judge that. I had a lot of opportunities for advocacy as well. I was actually able to attend the California all member advocacy meeting, and I was actually able to speak to lawmakers or representatives of lawmakers, talking about different bills that really make a difference for our patients' access to care, including things like not limiting Medi-Cal or Medicaid access to simply citizenship. So I got a lot of those experiences there, and it was a really amazing experience. And one of the things I really appreciate is that I had the opportunity to create the experience that I wanted. There were so many more options and so many other ways that you can serve the community, and you can find what helps, what is the route that you feel is you are the most passionate for.
Thank you so much for sharing, Milo. I'm sad you're not a fellow with us anymore since you've since graduated. I do just also want to add quickly, we have two really phenomenal we call them hub leads, our physician mentors or leaders in the Inland Empire. They are Dr. Mozum Bajwa. And in our second cohort, which we're running right now, we also have Dr. Gabby Pina. I saw she was on the call for a second, but I think she had to jump off. Milo, I don't know if you want to share at all about what it was like working with Mozum during your fellowship year.
Yeah, I'd be more than happy to speak to. So Mozum Bajwa, he is the first hub lead for the area. So back in my day, we only had one hub lead, which was Mozum. Mozum is just an amazing human being, an amazing physician. He's the one who pioneered so many of these programs I'm talking about. So things like the high school programs, helping promote interest in social medicine amongst high schoolers. That's a program that that's been very much something that he's been at the head of the charge of. Um, Not mentioned, but was one of the programs that we have with UC Riverside is that starting honestly within the first 2 months of medical school for the students, they actually go into primary care clinics to actually learn what it's like working with family medicine doctors, working with primary care internal medicine doctors or pediatricians. An experience that not a lot of other places that students have access to. And he's been the pioneer of helping keeping that program going, as well as food as medicine. He's just been an amazing force for the area. I can speak to Gabby. Gabby Pina is a pediatrician. She works specifically a little bit more closely tied to Loma Linda, but is very much based at the Riverside University Health System, the main medical center in Moreno Valley. She is an amazing doctor and she is an amazing person, incredibly passionate about the work that she has, and I'm jealous of the people who get to work with her too.
Thank you so much for sharing all of that, Milo, and you're an incredible physician as well. Wonderful. All right. So since we've heard a little bit about each of our hubs, Kia, if you want to launch the next poll, what hub most interests you? All right. This time I can see them. I see LA coming in the lead. IE is tied with LA. Fresno in the bottom. All right, and I think we can close that out. Cool. Um, well, if y'all have after this webinar's over, if you have more questions about the specific hub, or if you want to get connected to one of our hub leads, feel free to email me. I'll send out my info as well, and I'd be happy to get you connected to our hub leads. They're very eager to meet y'all, get to know y'all, answer questions you have and I'd be happy to connect you with them. All right, and so for this next section, we'll briefly go over the application process itself. The applications opened back in mid-June. They are on the HEAL website. Reminder, the priority application deadline is September 15th, so you have a little less than a month. Starting in October, interviews will begin. Expect about 3 interviews amongst both the HEAL internal team as well as Hub Lead and other faculty or local leaders at the FQHC or sites you would serve at. And the applications will officially close October 15th. We aim to have offers out to folks by mid-November, and then have the finalized social medicine class by early December. And just to state, a strong applicant, it's required that if they have completed their residency by July 2027 in either IM, FM, Med Peds, or Pediatrics. As you've seen with Milo and Robin, and if you've heard about our hub leads, a strong applicant will be passionate about making meaningful, sustainable impact in the community that they serve, and specifically in resource denied communities, as well as prior connection to California communities is a plus, but is by no means a requirement. And here is just another way of looking at the applications are open. Check out our HEAL website to start the application. It is a relatively brief Google form. We ask that you also include 3 references. These are references. This is not a recommendation letter. This is just references. I believe one is from your program director and then 2 other references of your choice. Also write a brief personal statement in the Google form. Of note, since our application is through Google Form, it does not auto-save, so we do recommend working separately in a Word document or a Google document. If you have any problems with the application or questions, you are welcome to email me. My email is on the screen. And here in front of you is the QR code as well that'll take you directly to the application. All right. And one of our last polls, what part of this program most interests you? And this is a longer question, so we'll leave it open for just a little bit longer. All right, and I see mentorship in the lead. Oh, and it's tying now with leadership, advocacy, and structural competency training. Those are some of our core pillars that we teach. Also, the 30% protected time for community health project work. Absolutely. That's a big one. All right. And you're welcome to put in the chat too if there's other things you're excited about for this program. Wonderful. Cool. And then we will go on to our last poll for y'all. Do you plan on applying? And it's okay if you don't know. We are here to answer questions you have, clarify things for you. We'd be happy to help just make it as smooth as possible for you. And I see it looks like a few folks are planning on applying. That's wonderful. Or they're still unsure. Wonderful. All right. Great. And so now we will transition into the Q&A portion of our webinar for about the next 15 minutes or so. Kia, I will pass it to you first to kick us off with any questions that came in the chat.
Awesome. And then, yeah, feel free if you do have questions that have come up to put those in using the Q&A function, and we can, answer those live. But one of the questions, we talked a little bit about the curricular pillars of HEAL, but what is the kind of content that someone would learn at the global health training?
Absolutely. Shri, do you want to field that question? If not, I'm happy to.
Sure. So what are the topics that would be covered in global health training?
Yes.
Yes. So there's a ton, we have several pillars of our curriculum that I think were mentioned. Advocacy, leadership, power and privilege, which is kind of using your positional power in order to to understand the context that your patients live and work in, and then advocate from both a place of privilege and also a place of humility. And then structural competency, which is really like understanding structural violence and a lot of the social context in which our patients live that affect their clinical care. And then lastly is well-being. And so all of those pillars kind of are longitudinal throughout the whole year. And I think what's really phenomenal about Heal over the last 10 years is that there's a lot of case studies from different parts of the world and California. And so a lot of the topics are very rooted in pragmatic and practical approaches to the work. And so you have both mentors and alumni that have kind of crafted cases and sessions that we've had a curricular team for years that have really done a great job of teaching these topics. And these topics kind of diverge from what you've probably seen in med school or residency or other coursework because it's really grounded in proximity to the communities that we serve and taking those lessons and context to build out kind of advocacy and leadership in that definition that might be a little bit different than what's usually taught in coursework.
Thank you, Shri.
Awesome. We have a question in the chat. It seems like there is a lot of variety in clinical roles people take on during this year. Is it based on individuals' interest or is it usually preset based on the hub you are located at?
So
I,
I can,
Go ahead.
no, go ahead. I can
You go,
answer that.
Shri.
So, I think the social medicine fellows are physicians, and so they come into different hubs, and some of the hubs recruit for kind of all of the all of the different types of primary care specialties, and some of them are a little bit more specific on like FM or IM, and potentially PEDS is not, I think each hub lead and the FQ like have to make sure that PEDS is possible in that site. And then I would say that the clinical roles are kind of crafted both based on the needs at the FQHC as well as the context that you're working in. And so we try to have fellows that come in with a lot of humility. I think you have to be, comfortable with some degree of autonomy. And then, basically is like what is needed in the context that you're serving in. But it will be within the scope, clinical scope will be in the clinical scope of your specialty. So, if you're a IM doc, we won't be asking you to do stuff that is out of like ethically out of the scope of your practice.
Awesome. Thanks, Sri. And then also if the person who asked that has specific questions in terms of interests and hubs and how that aligns, please reach out via email and we're happy to answer those directly. And then we have another one. There's a question asking about someone who's an internist by training and now works in public health at the CDC. Would the fact that they've not been full-time clinical, only part-time volunteer at CHC exclude them as an applicant?
It would not exclude you as an applicant. I think you'd have to be comfortable seeing patients, at a 70% kind of rate of seeing patients. And you wouldn't like a lot of the mentorship in Heal is around kind of the social medicine side and the advocacy side and the structural competency side. So clinically, if you're really struggling to be independent, I think it is a little bit of uh, a hard fit. That being said, if you're, you've previously practiced in a full-time capacity, sorry, that's the hospital, and then coming back into that, I think, you're probably more than capable of doing that. But I think for some folks, even coming out of residency, practicing as a new attending is challenging and being, I think that comfortability is part of the fellowship, but oftentimes it's not mentored by the mentor in the hub, specifically clinically. So you're going to have to feel comfortable being independent clinically, if that makes sense.
Yeah, thank you, Shri. And speaking of mentorship,
I
this could
think
be a good one
Milo
for
had something
you.
to say real quick.
Oh, yeah, go ahead, Milo.
So I forgot to raise my hand option. I did want to speak to specifically for the Moreno Valley Community Health Center, the Inland Empire hub. Admittedly, it's a family medicine clinic, but I can speak to like because it's a family medicine based clinic. I was very closely aligned because I was junior faculty. There was the expectation that I wasn't a full time, that I had not acted as a full time attending before. So there was a lot of support resources there. So I'm sure a lot of it does depend on the specific hub of like how much independence there is versus how much guidance there is. But speaking for Moreno Valley, there was a lot of assistance for like the more supervising side of things of patients, as well as just kind of the weird minutia of the first time being an attending of what do you mean I'm the one who has to respond to attending responses or to specialty responses.
Awesome, thank you. And then, yeah, going to the mentorship, Milo, you can be a good person to answer this. If you could tell us a little bit about what that structure is like and what someone should expect in, yeah, going through the mentorship part of the program.
Yeah. So as stated, like Mosum was the mentor and hub lead for the area that I was, and Mosum is very fortunately very available a lot of the time. Like he is happy to respond to answers and texts. Logistically for the program, there was like the expectation of monthly meetings with your hub lead. So there's that at least, but the mentoring goes across through different levels. It comes across in the one-on-one meetings. There's also the opportunity at the site meetings, as well as if you're more active on when you join the HEAL program, you do get access to a HEAL group WhatsApp so you can speak to other people. So that's another option for seeking out mentors who more specifically align with the interests that you have. But I think I can speak to Mosum was an amazing mentor. He really helped with a lot of things, like even just simple skills like speaking in front of live audiences.
Perfect. In action right now. And then another question. I know we were talking about the social medicine and then the community fellows. How do those different types of fellows interact in the program? Like, do they work together? How is that throughout the program? If, yeah, Avery or Milo, if one of you want to take that.
I can
Go
speak,
for
but I can give just my specific experience. Again, a lot of my things are very specific to a single hub, and from admittedly the first year that I've been in Access. So I was fortunate that one of the community fellows was actually at the same site that I was working at. So I was able to actually have a pretty good amount of chance of talking to her and her team. She was specifically a behavioral health specialist as part of a group that helps like bridge that is serves a lot of those ECM function or a lot of those community health worker functions, but it goes a little bit more in depth in terms of helping patients actually get scheduled with everything, kind of work like that. So I was fortunate that at least one of them was very closely aligned to me. There is also just that we did have our monthly hub meetings. That was a good option to get in touch with the other hub leads. A lot of it depends on the specific work that you're doing too. What are the specific things that you're interested in? So, for example, I was very interested in community health workers and free clinics. So, another one of our leads, or another one of our community fellows, was actually closely tied with another free clinic in Coachella Valley. So, that was another option. I was able to work with her, understand more about that clinic. A lot of it really depends on what your specific interests are, and a lot of it depends on what their interests are too, and seeing where those align. There's not like a structured, or at least in my hub, there wasn't like a structure. These are the ways that you will work together. It's very much deciding for yourself, like what are the ways that we can work together.
Definitely, that's great to hear. I know there's a lot of collaboration in the Inland Empire. And then we have a question on the LA hub. So since it's still being developed, it's new this year, would there be flexibility for someone coming directly out of residency to have additional clinical mentorship built in? And for the 70% clinical time, do you have a sense of whether that would primarily be at UMA Clinic or spread across the school-based and other community sites? Looks like Shri, you're ready to answer this one.
Jeez. Yes, the 70% time would be at OMA Clinic. I think if there's a there are some priority clinics, and I'm actually meeting with them next week I'm going to meet with them in person. Can you guys hear that? Sorry.
We can
Uh,
only hear you, Shri. Zoom's blocked it
okay.
out. You're good.
Because there's a code overhead. But I would say that I think for the peds folks that are interested in OMA Clinic, I think working with me and OMA to to craft a role that would be partially in the LAUSD clinic as well as the a specific peds clinic. So OMA does work across several different clinic sites as a large FQHC, like most of these folks. And so, really picking there would be sites that would be very focused on peds, that will be different than the FM and IM sites. So I can provide some more clarity on that. And then the mentorship, there's a large network of people that will be mentoring you from like a social medicine standpoint. I think there will be a clinical mentor at OMA, but they're not necessarily like a day-to-day clinical mentor. So I think you'd have to, I think the leap oftentimes for people that can be a struggle is moving from being a resident to being a new kind of attending. They see you as an attending, and so you're a fellow in the capacity of being part of HEAL, being part of the getting a lot of mentorship, getting a lot of support, having some backup, but not always on the clinical side. So you're kind of like Milo was saying, they do make make time for you to grow into that role, but you also like you can always run clinical cases by a larger community, but kind of day to day, you might not have kind of like somebody that you're like when you're a resident, when you have an attending that you can check in on. A lot of cases that would be you, which is a place of uncomfortability for a lot of people. But it's part of kind of graduating residency and taking that next step.
Awesome. Thank you, Shri. And looking at the time, this will be our last question. But again, if there's any other questions that were not answered, we'll have a follow-up email with all the information to, send us questions. But our last question is, what kinds of roles have physician fellows gone into after HEAL? And how do alumni feel the fellowship has influenced their careers or the way they practice? This could be great for Milo to start. And then Avery, if you want to jump in with maybe other fellows and what they've done post HEAL.
I had a feeling I was going to be called out. So for myself, I'm going to be starting work at Kaiser, or what Kaiser Redlands specifically. I had options. There were options of continuing work with county. It's just locations that have to work with my specific thing. There was like talk of possible options working with UCR and their programs, their community health system. That no options were offered in like the time frame where I need to start paying rent and everything. But that being said, even though I'm going into Kaiser, which is famously very much a just seeing patients kind of role, I'm hoping that once I'm there, I can see what are ways that their power and their leverage can actually be used in ways to actually benefit our patients. Additionally, I'm actually going to be one of the co-directors for the Riverside Free Clinic. So that's another way that I'm able to get that community work as well as education work. And I'm hoping to be able to, within my role at Kaiser, be more involved with their education program. And of course, making sure that the idea of social medicine is something that is very firmly front and center of the work that they're doing there. And there's always options of things like working with Kaiser Family Foundation, a lot of other things that I'm hoping would possibly be able to do. But in terms of like ways that I practice, I think one of the most fundamental things about the fellowship is there's a lot of this talk of the ideas of the physician fellows, the social medicine fellows, as well as the community fellows. Those are the community workers that we work with. One of the things that I really took away from that was really important was breaking down like the barriers in the hierarchy that is very often implicit in those kinds of things from the ways that we talk. And I feel that it's made a lot of difference of how I work with my nursing staff, how I work with the other workers that I'm with, whether they're pharmacists or anyone else. It also makes a difference in how I'm able to talk to patients. And then this is saying like this isn't like a full Disney story of I was a villain beforehand, but I think it helped give a lot of opportunities for practicing those kinds of methods of interacting with patients and interacting with staff, and recognizing how much of the power and stuff is in their hands and how much of my role is working with them, not trying to serve a purpose that I'm only giving this thing to them, but actually as part of the team.
Go ahead.
Thank you for sharing, Milo. And that being said, for the sake of time, I am going to move us on to our last slide. But if you would like to get connected to Milo, not to put you on the spot, or our two other alum, Dr. Jenny in Fresno or Dr. Ruth in San Diego, which was our former hub, I'd be happy to connect you with them and they can share more about what they have been up to post fellowship. Um, this final slide, just a reminder, reach out with questions. My email's on there. I saw that some of our hub leads and Shri and Milo dropped their email in the chat as well. I'll send those via email. Also, feel free to engage with us on social media. We'll be doing various recruitment activities from now through October. And then lastly, that QR code will take you directly to our application link. And I want to give a shout out to all of you for attending the webinar. And thank you so much. And thank you for your interest in social medicine.